Hey, welcome back, everybody. It's time again for another episode of Health Talks with Dr. Trinh, the one show, the only show that shows you the path to a healthier life and tries to answer some of the confusion along the way that we all have. And today, well, this is probably the most confusing topic for the last 10 years. It starts with C and ends with D. It's like that old music man, and all it does is spell trouble for most of us here. COVID. We're going to talk about post COVID with a bunch of people that are going to give us some information about this. We're working on this right now. Welcome, Dr. Trinh, and bring in your guests here. Uh, Welcome, guys. So, before we launch in and have you all tell your stories here, we're, of course, not giving medical advice, all that stuff, no disclaimers, go check your doctor, everything else. But here's what interests me about this topic. And then we'll let you tell your story here. Let me just set it up a little bit here. 2 years ago, something hit called COVID. And since then, the general public has felt whiplashed, confused, conflicted. Is it real? Is it fake? Will the vaccine work? Maybe it works a little bit. Maybe you got to boost it. Maybe even then you get sick. Maybe it's when you get sick, it's 10 days. No, maybe it's 5 days. And the everything is changing. And on this show, as we'll probably hear this morning, people are starting to say, I don't know what to believe anymore, guys. I really don't know what this whole thing is about and what will help stop it or keep me safe. And one of the most confusing ones isn't just getting COVID. It's those who get COVID in this so-called long hauler syndrome, where it sticks around and maybe it's causing other damage and it's doing other things here. And people are like ignoring that one. Well, we'll worry about that one later. I'm just worrying about, am I going to get sick today and am I going to have to go to the hospital here? Or am I going to have to isolate for 10 days, 5 days, 2 days, 200 days? I don't know. So that's the background in which we're talking about this. And it seems like that's the world you're working in. So we're hopeful that you're going to give us some clarity about this. Let's start with Isaac because he's the head of this company, I guess, here, or this organization. What the heck do you guys do and how did you get into this? Okay. Okay. Hemp derived, something out of hemp. Okay. All right. Oh, wow. Yes. Okay. Right. And THC is the stuff that gets you high or that has the whole effect, right? Yeah, exactly. Okay. Hmm. Wow. Wow. Okay. So, Dr. Michael Stewart, all of a sudden you were out and then you're in again. What brought you in again? Mhm. Right. Now or never. Mhm. Mhm. Right. Mhm. 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 Wow. Okay. People would come to your little town. I assume you're still in some little town and see the little local family doc to treat HIV. Uh-huh.
allows that deer to go back to its natural state of being. So when I started studying the endocannabinoid system, I was just captured by it sort of in the same way I had been with HIV, because HIV interacts with all of the different systems in our body as well. Let's see, I might need a little bit more direction. I'm sort of gone off on my own tangent. If you bring me back where you want to go, we can, or I can continue down this direction.
So we had stopped where you had called us, Lori and I, and informed us that you had to go in to the COVID ER and couldn't continue with us.
Right. So, gosh, when was it? February or March, I think, in 2020. I was actually in Denver with the company, and I got a call that the local COVID center, you know, they were also doing HIV care. So I knew the docs there. Even when you're retired from HIV care, you sort of have a fraternity of other docs or sorority, and you know who they are and what they're doing. So they reached out and they said, "Hey, Mike, can you come back? We really need you here." And I guess I did call Isaac and said, "Hey, I got to take a break." I didn't think I said I was going to leave, but maybe I was a little overzealous at the time. And so I actually went back to California, where I had been living previously, and I started doing my continuing medical education here for COVID. And I started vetting some of their sources. And the next thing that I knew, I'd gone down this rabbit hole about all the different inflammatory markers we were following with COVID, and how interleukin-6 was kind of leading the way. And I started thinking, you know, cannabis attenuates every single inflammatory marker I have been looking at here. And so that prompted me to do a little deeper dive. And I did some research and went through every single inflammatory marker that they were talking about with COVID, and discovered that there was literature on cannabis and or its constituents to attenuate every single inflammatory marker there. And so what we decided to do there was to develop a formulation. And we did the research. We developed the formulation. I wrote the white paper, and we were out there. I can't exactly remember how we came across this group of folks who called themselves COVID long haulers, but it was toward the end of the summer, not this last summer, but the summer before. They found us, or we found them, and we wound up doing a 10-week question and answer podcast. I would give maybe a 10-minute presentation about something that I thought might be intriguing, and then we'd have questions and answers. And I got a reasonable feel for the kind of symptoms that folks were having. I noticed a lot of similarities between the people I was talking to and the HIV clients that I was dealing with. And these folks, you know, nobody was listening to them. So probably the most important thing I did at that time was to listen, as much as I did anyway. But we wound up putting together a formulation so that we could help folks who were acutely having issues with COVID. And then I think it now will bring us into December, I think, of 2020. We actually had our product, and we put it into the marketplace. And our chief revenue officer went and did an informal survey on folks who had purchased our product. He found a group of them who had actually purchased it to treat long COVID. And anecdotally, we got a very strong signal from that survey. People did very well with it. Everybody responded. It was 2 to 14 days with an average of 7 days. And so at that point in time, we put together a clinical trial, went through the institutional review board so that we could actually collect data compliantly on humans. And because our market is more of a nutraceutical than it is a prescription medication, we're already in the marketplace. So this is a post-marketing study. We can talk about the different phases of clinical trials if you'd like. There's phase 1, where we're really looking to develop kind of safety data. And phase 2, we kind of put it into people, and we're developing more safety data and dosing data. And then phase 3 is usually a larger group of people, and we're still collecting safety data, fine-tuning our dosing stuff. And a phase 4 trial is a post-marketing study. And so even though we're still collecting information, you know, that we would get from phase 2 and phase 3, it actually is a phase 4 post-clinical marketing study. Sure. Yep. It gets even more interesting.
That's amazing.
Well, we put together what was supposed to be a blinded placebo-controlled trial because, you know, that's sort of the gold standard, and we want evidence-based medicine, and we want to play with all the other doctors that are using evidence-based medicine. And so we put together this trial, and we wound up needing to do an interim analysis because of recruitment issues and cost issues. And we were very excited in the interim analysis because of the results that we got. And then when we got further and we unblinded the study, what we found was the placebo that we were using, which was supposed to be an inactive thing, you know, just a placebo, sugar water or something like that. But we wanted it to taste similar to the product we were using. And our results showed that our placebo had active ingredients. And so what it did was to make our blinded placebo-controlled trial a failure as far as academic significance is concerned, because with an active placebo, it's difficult to tease out the information. So what we have now is a clinically relevant study, which I believe supports 2 products now that we have that will help attenuate the symptoms of post-acute COVID syndrome. One of them is a full flower cannabis medicine, and the other one is even more exciting because it's cannabinoid free. And with the cannabinoid issues that we have in the United States, not all institutions can use them. And if you needed to be drug tested, it would be an issue. So we now have a cannabinoid-free preparation, which we believe will help attenuate the symptoms of post-acute COVID syndrome. And we're in the process now of doing some case studies and another more in-depth clinical trial to actually get clinical or statistical significance on our study. So in a nutshell, the other amazing thing that wound up happening is that we set out to find one product that would help with COVID or long COVID. And it looks like we found two, one of which is able to be used by anybody in the population because it's cannabinoid free. The other preparation may work a little bit better, and the future studies will hopefully ferret that out. But it does have some cannabinoids. So if people have a problem taking CBD, it also has a small amount of THC in it. Folks will be able to take the cannabinoid-free preparation.
That's amazing. Where are you at with what is long haulers?
I wish I had a perfect answer for it. However, it is the continuing to have or having again symptoms of COVID. And what's the cutoff now? I think Dr. Trinh, you know better than I do. About 90 days, is it? 90 days, is it?
Yeah, about 3
weeks. Yeah, you have to have one or more symptoms of COVID that are either lingering, have returned and not gone away.
Right.
Or, I mean, I was going to say, you're more of an expert in this area than I am, but I think in a nutshell, that's probably what you're looking for.
Yes. What are your clinical trials plans at this point?
So at this point in time, we're working with a couple of centers and open to working with more, the post-COVID care centers, to be able to do some case studies. So those will be more individualized, smaller groups of people we'll be working with. And now that we are going through, and believe me, the data on this trial that we've just unblinded is still in the process of being reviewed. And it's giving us excellent information about how to go now for a more in-depth clinical trial so that we can capture the control group and the placebo group that we missed because of the way the placebo became active. So we're very happy about the trial results, and it puts a little bit more work on our plate. So the good news is the recruitment issue that we had in the past with this trial, I think, has been resolved. We'll be able to recruit it fairly quickly. Yep. And we're in the process of now working with some folks that have more information about statistics than I do. Remember, I'm a family practice doc by training. I love to do research. However, it is out of my wheelhouse to design these. So we're working with a couple of folks that I have a lot of confidence in. We're going to have a very robust clinical trial. It's not going to stop us from doing case studies in the meantime. So if there are folks out there that might be listening who have a large group of post-COVID people who are still having these symptoms and they want to be involved, we can go down the case study route, or we can go down the clinical trial route.
So let me ask you again some clarifying questions. So we've heard this amazing story, and you've stumbled onto what seems to be using hemp and the cannabinoids in all these plants. You found some anti-inflammatory things that might work for long haulers syndrome. Is that what I'm gathering here out of this?
Yes, that's the tip of the iceberg.
All right. And so having found this isn't going to get turned into a drug that the doctor's going to give you. This is a pill or something?
So our preparations go underneath the tongue and they're absorbed that direction. If you swallow it, it's not a problem. You will get the rest absorbed in your GI tract. It's just not absorbed as well that direction.
So it's sublingual. It's under your tongue here.
You've got it. It's a sublingual preparation. Our product, we are not going after an investigational new drug application, which is what Big Pharma does, and for good reason, because you can then get a patent and recover your costs. So what we are doing is we're going down the road where we've developed something, and it's a proprietary formulation. We know how to make it. We've spent many years learning how to do it. We will not be allowed to make claims about our drug, but we will be able to share our clinical our product.
Yeah, don't call it a drug, right? I mean, you're getting into trouble here, right?
We will be able to share the information that we obtain through these clinical trials with other clinicians. They are IRB approved clinical trials. We can share that information. We just cannot make claims about it. The good news is that gets us around the 12-year and over $2 billion cost of a clinical trial. We can get these products to market in less than a year.
Wow. All right. And when the product comes, it'll be what, at CVS or Mother's Markets here or something? Will it be?
We want you to ask your clinician for it. We want you to get it through your clinician.
Okay.
The folks that we market to are the clinicians out there, because this is a medication, it's a formulation, and whether it has a prescription attached to it or not, if you get your care from the gas station or the hairdresser, that's the type of care you're probably going to get.
Yeah.
And if there's one thing that I learned from doing this clinical trial and recruiting people, is that there is a huge difference. And I'm not here to tell you social media is not an appropriate way to share information. It is. However, the people that were getting their care through Facebook were so different than the people that were getting their care through a post-COVID care center. It was night and day.
Right.
Please see your clinician. Please see your clinician.
Well, and that goes to my first opening monologue here, my little setup. We don't know who to trust anymore, so we're just making it up ourselves. I don't know if I believe the doctor. Sorry, Dr. Trinh. I don't know if I believe the CDC. Yeah. I don't know. So I'm listening to my politician. I'm listening to my buddy next door. I'm listening to the cable news channel. I'm listening to social media, and I'm trying all sorts of wacky things because I don't know what this is, how it works, what works. And so therein lies some of the confusion. We don't know who to go to. I don't know that I go to a clinic, you mentioned this term post-COVID care clinic or something. I don't know where there is one. All I know is there are doctors, and every doctor tells me something different.
Mm-hmm. And that is a huge point that I can't overemphasize. You need to find someone to work with on this. I have over a quarter of century of work with RNA viruses. I was one of the leaders in this country in bringing novel therapies into clinical practice for HIV care. When I have a session with my healthcare provider, it is not a 10-minute discussion.
Right.
I need guidance on this too.
Right. Okay, so I'm still trying to wrap my head around this. Is this sort of like, what's the product? I don't want to give a shout out to the product names, but if we have to, we have to. But I know there are products like Cold Ease, and it has zinc in it. And so if I get a cold, which is, I guess, some sort of coronavirus or something related
Quite
to
oftentimes, yeah.
And all it does is doesn't keep me from getting it, but it supposedly shortens the time I have it. It makes me recover quicker. And I guess the key ingredient is zinc in it. Is that what's in it?
Right. And you need a clinician you can sit down with, and I can then tell you how that works and why it works and the importance of supplementing with zinc and an ionophore that can help drive that zinc into the cells. And while Cold Ease has actually done the clinical research to be able to show that they can shorten the duration of a viral illness, we want to be able to discuss the studies that are behind the different kind of approaches people want to take. So we want to be able to talk about that zinc, and then we want to take it just one step further and say, well, zinc works. How does it work?
Right.
Well, it works inside the cell, but zinc is a charged molecule. It's not going to get inside the cell very easily. So what do we do to get it inside the cell? This is the discussion you want with your care provider.
Well, my care provider is called Twitter. My care provider is called my cousin Joe, who swears he knows everything about this.
And there are beautiful providers out there that have made themselves. There's myfreedoctor.com, video sessions. There are groups of people out there that are posting through a variety. I'm trying to come up with websites, and my stuff is a little bit outside of the ordinary. So I don't want to drive people on YouTube off to, something that I personally find helpful.
Right.
They really want to find if it is not a doctor, find somebody who is medically trained who can be a clinician and walk you through this. If you are going to try to get your medical education by treating yourself with long COVID, you have a very difficult path to walk. Yeah. I'm not saying you can't walk it. It's just tough. Don't walk it alone. Walk it with someone.
I think that's the best advice I've heard today. So Isaac.
So are we going from cold ease to COVID ease?
Yeah, right. I guess that's what I'm getting
at.
I
have a name here for you guys here.
That's it. Isaac. It's COVID ease.
COVID ease. That's it. It's just to ease COVID. Yeah.
Maybe we can talk to the people at Cold Ease and we'll put some zinc in it too.
Yeah, there you go.
So we're very different than Cold Ease. Our clinical trials are very different than Cold Ease.
Yeah.
And Cold Ease is definitely a DIY solution, right?
Right.
Yeah.
The key message that I think we have as a company is, even though cannabis has tremendous potential, it's not one thing. It's not one active ingredient. It's not one plant. It's thousands. And so it's not appropriate to say, here's this thing. It works for everybody.
Right.
Isaac, I want to support that. Absolutely. Cold Ease is designed to be an over-the-counter medication. Yes. And that's fine for Cold Ease. What I want to support with Cold Ease, they did the clinical trial they needed to do to support their product.
Good, because I
really
know
want
that.
to support that. We are different from Cold Ease in that we're not an over-the-counter solution. We are a solution that is a tool in a toolbox. Cannabis does not work to cure COVID. Cannabis is a tool that is worked by a clinician to help.
So let me see. Let's unpack that and make sure I got it correct. So you're not trying to become an over-the-counter treatment for those who have COVID, long COVID, using the cannabinoid approach that you're pioneering here. You're trying to do, how do I get it then? Where, if I don't go get it over the counter?
And we're so over the counter is something very specific.
Right.
Right. Our product is commercially available. Right. And except that when you go to our site to buy it, it's not going to tell you anything about what to use it, how to dose it, because you need to have that conversation with your physician.
Right.
Right.
So it's not something you're going to get over the counter, meaning like aspirin or like Coldy, something that's going to relieve a symptom or help shorten the duration of something here. Even though that might be what it does, that's not the marketing plan for this at this moment. It's something I go, directly to the site and just buy, and then go to my clinician and say, how do I use this?
The opposite. So the clinician will typically be the first person to hand you the product.
Oh, okay.
Right? Because you need instructions first.
And will doctors, clinicians, whatever you want to call them, will they be open to this? Is Dr. Trin he's open to lots of things. So many doctors are going to say, I'm not open to anything. I got no answers. Take this pharma pill if I have anything in my arsenal. But most of my doctors aren't having a conversation with me. I'm sorry. That's a whole bigger debate we've talked about in this show. I get 3 minutes in the assembly line to get moved in and moved out. And there isn't a lot of conversation happening when I go see either the clinic I go to or my actual family practitioner. They're all pushing me in and out in 3 minutes.
Well, and so let's, rather than answer the question broadly, let's just talk about it from a long COVID perspective.
Okay.
Right. There's a website which we have no affiliation with called Survivor Core.
Okay.
Right. Highly recommend anybody that has long COVID that has not been able to find an individual practitioner that they feel comfortable working with, that they go to Survivor Core. All of the long COVID centers in the country are listed there. Go interview a couple in your area. You'll be happy with one of them.
Good. I like that. Okay. And then you start there, and then are they all familiar with your product, or is this something?
They aren't all, they aren't. Some are, right? But remember, our first message is not, we're the solution to long COVID. Our first message is, don't try to treat yourself alone for long COVID.
Yeah.
Right. At least one medical professional must know everything you're taking. right? Don't leave out the thing that you bought at the pet store because you're embarrassed.
Yeah,
A
right.
doctor needs to know.
And
One
you're
doctor
kidding. You're
needs-
kidding. But that one drug that I'm sorry to say Trump and others were pushing was actually some sort of an animal. It was used in animals.
All of the drugs. Just because a drug is used in veterinary medicine
Right.
does not mean it is not applicable to people.
Right.
The issue is the veterinary preparations are prepared differently with different standards than the
Really?
human preparations are. And if you're using the veterinary preparation for human use, you better know a lot about what you're doing.
Right, because you're not putting it into a hamster or a horse.
Exactly. And
right.
you're generally changing different measuring standards and at any rate, I do not recommend using veterinary medicine in humans. And just because something is available for a pet doesn't mean that it's inappropriate for humans, but by the preparation that has been prepared for humans.
But again, it goes to the desperation and the confusion, and so we all feel like I'll try anything and everything. You tried that? Give me it. I'll do it. And I think that leads to some of the confusion. So I want to emphasize and support what you guys are saying. Give me that site again if I want to go. If I think I have long hauler syndrome, and there's sort of a support group or a site that you're not affiliated with that might direct me to somebody who can work with me on this condition. What's the name of that site again?
Survivorcore.com.
Survivorcore.com.
Ask me to spell it.
Okay. No, I think we can figure it out. And then.
And what is your site? Is your site public?
Yes. So our company name, Entourage, which is an easy way to remember the spelling. It's like 3 words put together: End, E-N-D, Our, O-U-R, Age, A-G-E.
End our age. That's what I want to do. I want to end the
End
age
our
of.
age. You're a longevity company.
Yeah. Well, entourage stands for the endocannabinoid system and the entourage of the cannabis plant.
Wow.
Love
So
it.
we changed one letter, and we merged the 2 words together.
Okay.
That's
there you go.
beautiful.
All right. So you've got this. And how long have you been doing this? Is this new? Is this months, years? How long is this?
3 years. The company's 3 years old, and we have a pipeline of 7 therapeutics right now.
Okay.
This one is the first one that we've completed clinical trial.
Let's go off COVID for a second, because we're all under COVID burnout, even though it ain't going away, and we're going to have to learn to deal with it. And even though Pfizer and others are coming out with other drugs, not necessarily for COVID long hauler syndrome, but they're coming up, I'm told, treatments that will help shorten the duration of COVID or make sure it's not as severe or whatever. They're coming up with not just preventative measures so you don't get it, but treatments so that it's more manageable. And this kind of falls into that realm of treating something, of helping you battle an ongoing chronic persistent problem that won't go away. Cannabinoids, Dr. Trinh talks about this all the time. This is an amazing plant. And I'll preface it by saying I'm at the University of California, Irvine's Beal Applied Innovation Center. One of the innovations we've been introduced to, we had him on one of, not Dr. Trin's show, but another show, at UC Irvine, there is a cannabis research institute of some sort. I don't know what it's called, but they have a federal license and have had for a while that they get to play with this plant where others don't. And the director this is years ago, came on, before all the crisis came up. And he said, this whole cannabinoid system, which, as the doctor pointed out, wasn't taught in medicine, it's still sort of relatively new, this understanding of how our body intakes this stuff and the receptors in place to respond to these things that are in this plant. And his theory was, we've researched, 3 or 4 cannabinoids, 3 or 4 of these little ingredients in this plant. THC, because it makes you high. CBD, because it has some sort of anti-inflammatory thing, and you can get it at Mother's and CVS and everywhere now, and maybe 1 or 2 others. He said, but they've identified, am I correct, like 100 ingredients, these cannabinoids?
That's just cannabinoids.
Over 400.
400. Okay, last time I heard it was 100.
That's my it's going up, but it's not going down.
And so his theory was, look, let's say there's 100 at that time. They're not all 100 going to do magic, wonderful things. But if two or three of them have found to have strong qualities, what are the odds that some of these other guys are going to do some magic things here?
So
You know what, though? You just hit on this whole big thing, because it is not the individual parts of this plant that work.
Okay.
Pharma has had over 100 years where this plant has been demonized and kept for them to do their research on it, to try to isolate the different components and then concentrate them and Frankenstein them back together and make it talk.
Yeah.
And I agree that that was a great thing to try. And after a century of trying that, fortunately people came before me, and I've looked at what they've done. And I say, don't take the plant apart. Keep it as full as you can. If you keep this plant as close as the way Mother Nature made her, and put it in a bottle and only take out the components that you absolutely have to, those hundreds of medicinal qualities or medicinal components of this plant work synergistically together to be incredibly safe, because they are in the different concentrations together that Mother Nature designed. It's something our body recognizes when it comes into our bodies. We co-evolved with this plant over millions of years. We developed an endocannabinoid system that interacts with this plant. Please don't take it apart and Frankenstein it back together and expect it to work the way it should.
Isaac's nodding. Do you agree with that, Isaac?
Oh, I can barely contain myself. So my couple of things. First of all, we must remember cannabis is a domesticated plant. It's a cat, it's a dog, it's a cow. It is not a tiger or a lion or a shark.
It's not a wild animal just raging around.
It is not a wild animal. Its name, Cannabis sativa L. The word sativa means cultivated. So this plant was first domesticated 10,000 years ago by the very same people who first domesticated the horse, right? Right?
Okay, I didn't know that.
Back then, cannabis was a mobility solution, right? For example, today we're talking about going to Mars, right?
Right.
And so I asked, how much payload do you have on your rocket to Mars?
And Dr. Trinh says he's going to Mars, by the way. Elon Musk and he have had some conversations, and he's going. So I'm just telling you.
And so what's your plan, Dr. Trinh, when you land on the surface of Mars, and the only thing that you have is the space in your spaceship that has your payload?
Right.
How big is that?
Not big.
And so if we go back to, think about it, I'm sure you know that with a circle, right, or the more you increase the radius, the area changes logarithmic, right? And so the people that discovered the horse had a unique opportunity and a unique problem. They could now travel great distances so great that one could not walk them.
Right.
And so they began branching out. And what they took with them to survive were seeds. They took cannabis seeds. Okay. And the reason why they took cannabis seeds is because wherever you got, the first thing you would do is scatter the seeds. The first beginnings of the plant are edible. And so you would have a food relatively quickly, and it would continue to be edible as it matured. And while it matured, you'd now have all the input material for your textiles. When we think about America was settled with cannabis.
Yeah,
those covered wagons.
George Washington grew it. Thomas Jefferson. They made rope out of it. They made cloth out of it. Yeah, it was a common.
Everybody.
Yeah.
We were all farmers. Everybody grew cannabis. And in fact, if you do the work, all of civilization is tied to cannabis because it solved that first problem for the people with the horse, as they were able to then spread out successfully and conquer new lands as humans. It was all tied to cannabis.
And it's a pretty hardy plant, and it grows quickly, and so you can eat it or you can feed it to the horse. And then when it grows, you can take the fiber and turn it into cloth and rope and very strong things, all of which they use for.
This is not an accident.
Yeah.
This did not happen. We did not discover this. 100 years ago, 4 commercial entities figured out that they had the opportunity to take over the most dominant globally traded commodity by making it illegal in the United States. That's where it all started.
Yeah. And the DuPonts of the world, and I don't want to get sued by DuPont, but the DuPonts of the world came and said, we're going to come up with chemical fibers, a rayon and other things here to replace plant-based fibers.
And that all started with the discovery of petroleum, right? Petroleum is not thousands of years old.
No.
Right? Petroleum, what's very interesting, petroleum is a plant extract, right? It's just a very, very old one.
A plant that died and rotted, and there it sat in the ground. And so, interestingly enough, I was watching a special a couple of years ago on John D. Rockefeller. Standard Oil, who at one point owned 97, 98% of oil production. I don't know if it was in the world or just the U.S., but a monopoly like we've never seen, like nobody had ever imagined. That's why they just split up Standard Oil and all these things. Imagine owning 97% of any market today here. And his wealth, if it was calculated in today's dollars, wouldn't be 30 billion. It would be like 700 or 800 billion dollars, almost $1 trillion. So anyway, the whole point of the story was when he did oil in Pennsylvania and elsewhere, they threw the petroleum out. All they wanted was the kerosene to burn in the lamps. They didn't know what to do with the oil. There was no gas engine. They didn't know what to do with this sticky, mucky stuff. So they threw that away and just literally threw that away. The gas they threw away and the oil they threw away. They were trying to get the kerosene. And it wasn't until later they went, oh, this other stuff has some value to it. Yeah. So you make a very compelling case that this stuff was around. Hemp got thrown under the bus when marijuana that had more THC that got you high.
This is a new invention, by the way. This concept that there's low and high THC and so it's always been a multi-use plant. People always got high. And there was never a stigma around its use before.
Right.
And the proof of that is if you look at a great, if you study Muslim religion and some of the great mystics from their practice, hash was common, right? Alcohol is forbidden.
Yeah, right.
Hash was commonly used.
I didn't know
We also know that in Israel, just a couple of years ago, they uncovered an intact altar that was specifically for burning high THC, right? Because they did the analysis, high THC on an altar in a very small enclosed room while praying.
And gee, right? did you see God in that moment? Probably.
Maybe.
The entire stigma around cannabis and all of its uses was manufactured. None of it is based in science. And that's the crazy thing.
Well, you must be happy over the last few years because I've never seen such a change. I do business shows mostly. And the most business Republican types come in here now, like the former Speaker of the House, John Boehner, Republican Speaker of the House, and many others, the former Republican Attorney General here, Lockyer, whatever his name is. And they come in here all the time over the last couple of years and say, hey, you know what? Cannabis ain't so bad. Not just because we can make money out of it, and particularly hemp. McConnell got through the agriculture bill under Trump. That hemp was suddenly okay, and they've been growing because he's from Kentucky, where they used to grow it forever. And it ain't all about getting high. It's about the power of this plant that they're suddenly once the reefer madness hysteria died down that was whipped up in the 20s and 30s. For all the reasons you talked about, suddenly, they're rediscovering this plant, and the acceptance of it has been shocking. I remember a year or two ago when somebody came in and started talking about CBD. It was the first time I ever heard about the anti-inflammatory properties of that, and went home and told my wife, "Have you ever heard of this?" She said, "We got some in the cabinet. I got it at CVS," and I'm like, "What? We have marijuana in the house here?"
Well, if you got it at CVS, it might not actually have any CBD.
All right. That's a whole nother discussion. So
yeah, what's in the bottle and what's labeled on the bottle, unfortunately, in this business, tend not to be the same thing. And that is something to discuss. If you are buying a cannabis product, you must insist on a certificate of analysis. It is not an option.
And I don't disagree with that. I know we're running out of time here. That's a discussion we've had on the whole nutraceutical industry as a whole.
Perfect.
I think I'm getting St. John's wort, or I think I'm getting XYZ herb, and there's this much of it in it, or there's this much of it in it. You know, it's not regulated very well because it's not an FDA thing, and so the measurement is suspect, and then maybe there's 4 other ingredients you didn't want in there.
We are very prudent with our labeling. We have a tail on ours that gives the clinician the cannabinoids and the terpenes in there. We have a barcode to get to our COA. We've been tested twice by third-party companies. We are compliant. We produce clinician-grade products.
So last question before we wrap up today here. What's the future of this? Is this, you found one use for it, maybe long haulers. You're suggesting there are hundreds of uses that you haven't uncovered yet because there are hundreds of these ingredients. And I always thought it's about pulling the ingredient out and using that ingredient to do something, CBD oil. But you're saying maybe it's the complexity and the complete array of things there that gives the most benefit. You're on the cusp of some big breakthroughs here, I think, in this whole world and industry. I'm sure that's why you built a company around it here. What is the future hold for cannabinoids, and particularly for things like anti-inflammatory and COVID syndrome? What do you think? Is this going to explode? Are there going to be 1,000 companies like yours? Are we all going to all the doctors are going to know this and treat this, or does this still require lots of breaking through the veil and the 100-year-old image of this as evil?
Isaac, I think that's the best question for you.
Yeah. Are we on the breakthrough? Have we broken through, or are we still trying to get through?
So we're still trying to get through.
Okay.
Right? Because one of the challenges we have, even with clinical data, is that, well, it's interesting, but we're not allowed to use cannabinoids in our facility.
Yeah.
Even CBD. And why? It's federally illegal. Well, even though the Farm Bill happened, all the other regs, right, that reference them have not been updated. And so, in fact, in things like our military, instead of embracing CBD, what they've done is added a test in their drug panel when they drug test their personnel for CBD specifically.
To see if it's there.
I'm sorry?
And let me, again, we're going to go over just a minute if you're okay with this here. I know everybody's got to go. We just did a show 6 months ago or something. It was a very Republican type. I say that because these are the people who ranted for years against, marijuana and all this stuff here. And he was a lobbyist. And his son developed pancreatic cancer and painfully died rather quickly. And in the meantime, they gave him fentanyl, which knocked him out. So, isn't it like an elephant tranquilizer or something? It's an extremely powerful.
It's a strong narcotic.
And father said, he's out of it. He's a zombie. I want him to say goodbye to his friends, his kids, as everybody else. Can't we get him off this heavy narcotic? And what do you think about this? I've got some cannabis-based things that might still take the pain away, but without zonking him out. And the hospital said, we agree that it will probably work, but we're afraid to administer it or even let you bring it in because we will lose our Medicare funding. We will lose potentially government grants. We will lose all this stuff because we're bringing in an illegal substance, a type 1 drug, classification drug or whatever it is, into our facility. You can't use it. We can't use it. And he fought and finally, after 2 tries, got it through the California legislature. It's called Ryan's Law, where it gave people permission to try something on their own other than the strong narcotics. And it took years to fight that way through. So I think you're still at the cusp of acceptance for this within government and medicine. I wish you the best of luck in getting there. What's the site? A fascinating idea. Many people are going to want to learn more about it. Dr. Trin's going to have to bring you back in for a part 2 because we just opened the door and there's a lot more to discuss about this. How do they hear about you? Let's leave them with that. How do they find you?
Entourage.com.
And it's spell it one more time. END, I know that.
OUR.
Age, End Our Age on Dirage.
nrh.com.
There you go. All right,
Got
well,
it.
fascinating stuff here. You're preaching to the converted. We all believe that there's more here, and many of the people who listen to this show from left to right are all looking for other answers than what they're getting from their medical providers or from their cable channels here. We're all trying to find a way forward, and not just on this problem, but many others. And it sounds like you're on the cusp of creating some other applications or uses for this. Your products, not you found one or two, and you're hopeful. It sounds like you're going to find some more here.
Indeed.
All right.
Thank you.
Good. Thanks, Dr. Trinh. Take us out. That's it. He's just waving.
Happy meeting today. Happy.
Happy. All right, good stuff. All right. Thanks, guys. And one more reason everybody should tune in to Health Talks, because we're one of the few opening the door to these discussions. Right here in Orange County's only community radio station, OC Talk Radio.